thank you so much, and good morning to everyone, or afternoon, depending on your location. So let me go ahead and pull up our presentation. So hopefully that is showing now. For my co-speakers, is that looking all right? Perfect. Well, it is really a pleasure to be with everyone today, and we appreciate your being with us on this last session of the conference, or the last educational session. My name is Cheryl Holmes, and I'm with the University of Kansas. We are going to let each speaker introduce him or herself, and do have time at the end for questions and for discussion. We're trying to allow some time in between for translation, so hopefully I won't get excited about the content and start talking too quickly. Trying to get my screen to, there we go. We have a couple of acknowledgements that we want to mention. There are parts of the presentation that we'll be sharing today that are funded by different sponsors. So we want to extend a thank you to Patient-Centered Outcomes Research Institute, and specifically the Eugene Washington Engagement Award, as well as the National Institute for Occupational Safety and Health. We have three primary learning objectives for today, and they are that by the end of the session, we hope that participants will be able to identify the 5 steps of the research process, to describe strategies to support community-engaged research, and also to recall 2 lessons learned for helping researchers, farm workers, and community partners when we're working together, so that we can be promoting health equity, collaborating effectively, and actively engaging in the research process. So we do hope that this will be an interactive presentation. We know that all of you in the audience have experiences and expertise, and we really hope that we'll be able to learn from each other. We have the chat feature that's available, and we'll be monitoring that and then being able to respond during our discussion at the end. We had hoped to be able to use the polling feature. Unfortunately, there was a little technological glitch, and so we will not be using that today. But we are very excited that you all are here and look forward to the sharing of information during our discussion time. And the last bullet is related to a survey that we're doing. I had planned to set it the link in the chat box. However, the invitation is actually on the session screen where you can download the PowerPoint. And so basically we have a very short survey that's available in English and Spanish, and it has questions about how you all interact with research, how you use it, and an opportunity to share ideas for research that you think needs to be done related to the health of agricultural workers. In addition to being able to access it that way, the link will also be sent out at the very end with the overall conference evaluation. So we encourage you to take a look at that and hopefully be able to share your feedback and insights with us. So this was where we were going to do our first poll. If you want to share kind of your perspective of, if you're a researcher, a clinician, and so forth, in the chat box, we'd love to know who's in the audience, as well as if you are representing or working in a particular stream, Midwest, East Coast, or West Coast, we'd be interested in just having a flavor of who's in the audience.
Hello, can you hear
Hi.
me?
Yes.
My name is Diana Lady, and I I remember that I have an appointment to meet you pretty soon, but it was I saw that you were a presenter, so I wanted to hear your presentation. I am a student at KU University, and also I'm a CHW that work with Farmworkers. And since I've been working in just a small research, I am more interested in to know how can, like the title said, elevate the voices for our farm workers and change the narrative as we've been hearing in this forum. Um, and so I'm just excited to learn and to hear what you have to say. And also I read some of the things that you've been working on as well. And I'm just excited. Just wanted to say thank you for what you're doing and all the presenters.
Wonderful. Thank you. It's a pleasure to have you. And we do hope that by the end, we'll be able to share some ideas of different ways that we can work with farm workers and agricultural workers. So that's great. We'll be able to get a feel for how well we did that at the end. So let's go ahead and jump in then and talk about sort of the what, why, and how for research. So we'll begin with, in terms of the what, we are thinking of research as a careful study of a subject, especially to discover new facts or information. And the reason that this is important is that the research can help us make decisions, not only at like an organizational or a policy level, but really for the individual as well. And then the reason we think this is so important is that research really can help make decisions. But as part of that, it's important to think about how the research came about. So not only who is involved in supplying information, such as answering a survey or participating in a clinical trial, but who also helped maybe identify the questions that are being asked and the ways that different people can be involved. And we'll talk about that more in just a moment. So one type of research is called comparative effectiveness research. And this is a type of research that can be particularly helpful if an individual may be faced with a decision for which there may not be a really clear best answer. So true to the name, the idea is that we are including two or more strategies, medications, interventions, and then looking at how those kind of play out both in terms of risks and benefits. And so the idea is then the research hopefully will help when an individual is in a real life situation to be able to kind of take that information and make a decision based on their particular situation. Now, this is getting to kind of the point of our presentation as well, is that there's something called patient-centered outcomes research. And this is one where with traditional research, a lot of times there might be just one strategy or one medication that's being studied. With comparative, you're going to have two or more. But regardless, in either one, I think that it's something where we want to look not only at what the researcher thinks are important outcomes to study, but also the patient or the population that is to benefit should have some opportunities to weigh in on the outcomes they think are important. So as an example, if you have, say, two medications that are going to be studied, a doctor might be interested in knowing which one of those will help get a patient's lab values, for example, back into the normal range. A patient is going to be interested in that as for sure, but they also might be particularly interested in knowing Will one of those help me not have so many side effects and help me feel well enough to get back to work? And so that's where it's important to know what the population of interest also thinks are important in terms of the research being done. So that brings us to the stages of the research process. And on the screen, you'll see that we're suggesting that there are 5 different stages. The first one is to be able to choose the topic to study. So, knowing what, whether you're going to be looking at pesticides or medication, or, what is it that needs to be studied. Second is how you're going to do it. So, clinical study, focus groups, surveys, so forth. The third step is where a lot of people typically are involved, and that's when the data is actually being collected. Once the data come in, then you need to analyze and understand what it is. And then 5 is actually sharing the results. So what we're suggesting here is that you don't need to have everyone involved in all 5 stages, but it's important to have the different perspectives involved in those 5 so that you are having your stakeholders involved in helping to identify what needs to be studied all the way to the end where you're sharing the results. So today we're going to be sharing 3 different examples of research that has been done specifically around agricultural workers and COVID-19. And I'm going to be handing it off to Suzanne in just a moment to talk about some work that she and I have done with in-person surveys. And then Ricardo will follow talking about an app that was used to study social determinants of health. And then Athena will wrap us up with a social media to share preventative health practices. So I'm going to step aside and share this screen with Suzanne.
Good morning. I'm Suzanne Gladney. I am an immigration lawyer and the director of the Migrant Farmworkers Assistance Fund in Kansas City. We serve migrant and seasonal farm workers in Lafayette County, which is about an hour to an hour and a half east of Kansas City. Primarily, the workers that we're serving are some people that live year-round on orchard property, peaches and apples primarily, and some vegetable crops, and some folks who do alternate farm work in the winter months. As Cheryl explained, we are involved in the 4th year of a project with the University of Kansas School of Social Welfare. It has been a really interesting project, and it has been one that we have had a farm worker group working with us. The farm worker group has been primarily the same people with some additions of migrant workers as they come in over the last 4 years. It really has been interesting to see how interested they are in participating in this work and how much they have learned and how much their voices have been elevated in this process. One of the things that has interested us in being part of this today is to hope that groups involved in listening to this would consider working with researchers and having them really elevate the voices of the farm workers that they are researching. Our survey that we did with the COVID-19, our survey was administered in person. Ricardo and Athena, who are going to be speaking, have different methods of their surveys, which is what we're doing today, is to explain the different methods. Ours were in person. Our farm worker group, the farm worker group that has been working with us for 4 years, helped put together the survey that we did. We did an in-person survey. We worked with training surveyors Some were community health workers, some were staff of our organization, some were interpreters who worked at one of the clinics that serve the farm workers. The farm workers who participated in putting together the survey were paid $100 for each of their sessions that worked on putting the survey together, coming up with questions that they thought would be important. The surveys were focused on coming up with what sources of information and how farm workers best received information about COVID-19 and what they thought were the most reliable sources for them. We tried to remember the whole time that farm workers are the experts in this because they're the ones who live this life. They're the ones who have the lived experience. It's very important to hear their voices throughout. Everyone that received a survey and participated received $20 in cash right then. We were very careful to work through the IRB public human subjects process. Safety protocols followed with all of us wearing masks, hand sanitizers, social distancing. We were always outside when we were talking with farm workers with the surveys. Surveys took about 15 minutes, and the surveyor held the piece of paper and recorded the answers rather than asking people to write something. We have found that many of the farm workers we serve are not good writers or don't often do a lot of writing. And so that makes them more uncomfortable to ask them to write something themselves. We felt like it was very important, and the farm workers that helped us put this study together, survey together, felt that it was very important to have people that they know, people that they trusted, people that they had seen before, who were there doing the survey, so that it wasn't someone that they hadn't seen before. So people from our organization, from Migrant Farm Workers Assistance, were along with the surveyors every single time that they were doing the surveys, and many of us were doing the surveys as well. We had surveys in English and in Spanish. And along with when we were doing the labor camp outreach programs, we were doing the surveys then. So we were also doing food distribution. We were handing out masks and hand sanitizer. We were giving out T-shirts and different things that we normally do in our outreach. We felt like it was important if people had questions, specific questions that they wanted to know about COVID-19, that we recorded those and that we said we would be back and try to get information on those topics to them. We felt like that it was very important to have farm workers early in the process involved in putting the questions together, and they did that. They had some very interesting questions to add to the surveys and to put together. We felt like it was very important to have community partners there. So migrant education was often along with us, as well as our organization. We often had COVID testing. We had people from the clinic, nurses from the clinic there with us they usually are out with us doing blood pressure, blood glucose screenings, but they also had COVID testing. And we had many, many farm workers who really wanted to be tested. They wanted to be tested. They wanted to be sure that they weren't going to take something back to their families when they returned to their families. We completed about 70 surveys in Missouri. We also have a partner organization, a clinic in Texas that is doing surveys, this same survey, and they have completed 15 so far, and we expect that they will be completing some more as some of their seasons continue. We think that it's really important to be sure that you're taking time to think through the safety protocols at the time. As we all know, COVID-19 has had many different safety protocols as it's gone along here. And so just keeping up with those to make sure that you're modeling the safety protocols that CDC is putting out or your specific state is putting out. We learned a lot from the surveys. We learned that they wanted to be involved. We have been, in this process of 4 years, we have been very, very happy that the farm workers that are involved are very proud to be involved in the work that we're doing, in the survey work that we're doing, and in the research work that we're involved with the University of Kansas. They definitely have ideas about important questions that we were happy to be able to record in the survey. We also found out that, as we know from other situations, that word spreads very quickly among farm workers about whether it's worth their time to participate. So many times people would know that we were coming and would be lining up and saying that they wanted to do the survey and wanted to be a part of it. Some of them may not have participated in anything like this before. And so it's really important that you think about balancing the time that it takes and to tell them in advance, this is probably going to take about 15 minutes so that they can make an informed decision whether they have time to do that at this point. The location is very important. We found most of the workers that live in the labor camps don't have reliable internet at the labor camps. The labor camps are located right very, very, very close to the Missouri River, and there just aren't any cell towers down there. So many of them can't get any cell phone reception or internet reception of any kind. So when you're thinking about doing something like this, it really is important to be sure you have a clear idea of what their service is going to be available. We are now, again, not to a polling, but if you have information to put in the chat about the question that's showing up on your screen about the clinic account and what kind of percentage you have for patients' health, we would appreciate your comments. One last thing to say is something that I think probably a lot of us heard from our moms and dads that I think researchers and people need to keep in mind is just that you learn a lot more by listening than by talking. So listening to what they have to say is very, very important in this whole process. I'm going to turn this back to Cheryl to introduce Ricardo.
Great, thank you so much. And Ricardo, you can take it away.
Excellent. Thank you, Cheryl. So my name is Ricardo Garay. I am a program manager for community engagement and health equity at the Dell Medical School in Austin, Texas. And that is a relatively new medical school for the University of Texas here in Austin. And so in regards to the polling, and first of all, I want to acknowledge that there's already been a couple of questions that have been posted in the chat. So please, I want to encourage folks to continue posting questions. We will have a Q&A towards the very end, but please keep posting questions. So in regards to this polling, I hope that you guys selected 80%, because really it's 80% of factors that happen outside the clinic that affect the patient's health. And so I think it's so important to have that mindset when we're thinking about research, that a lot of these social determinants of health affect health in very influential ways. Cheryl, next slide, please. And so one of the things that I'm going to talk about is what we call OLA, which is stands for our household level assessment. Suzanne mentioned that her survey was an in-person survey, and that's really how we started. But because of the pandemic, we actually shifted into an online platform. And so that's one of the things that I'm going to be talking about here today. Next slide, please, Cheryl. So I'm going to start here by talking about the background for the household level assessment. So this was launched at the Department of Population Health at the Dell Medical School, again, at UT in Austin. We spent a lot of time with multiple focus groups. We had a lot of IRB adjustments based on these stakeholder meetings. It was an arduous process, but we really wanted to be making adjustments based on what we were hearing from the community. We had multiple stakeholders that were telling us, you know what, this is not, this question is not ideal. This is probably, you should frame it this way. We also at the Department of Population Health have a team that we have hired, that these are folks from the community that are called the Community Strategy Team. These are 6 members from the community that serve as consultants, and they get paid for meeting and providing advice and guidance to research that we're doing at the Department of Population Health. This team provided really valuable information as to how this assessment should take place in people's homes. The goal there was to learn about factors affecting someone's health and their family outside of the clinic, with the idea of feeding that information into a clinic so that the clinical staff there could be much more educated as to what the factors outside of the community were and how those were affecting the patients that they were seeing. This was about 45 to 60 minutes interview in someone's home. It's really powerful to be in someone's home and talk to them about their health when they're in their home setting, when it's a place where they feel comfortable. And so this really was for us a very, very important step to have this happen in someone's home. And we were providing $25 for compensation. We really wanted to make sure that folks felt that we were honoring that hour, at least with a $25 compensation. And we also scheduled these interviews based on the convenience of the participants. If they told us, I want you to stop by on a Saturday afternoon, we would go on a Saturday afternoon. If they told us, I get off of work at 5, but I need to set the kids up and make food, and I want you to be here at 7:30 at night, we would do that. So we were very flexible in making sure that this was always centered around the participants. We also followed up with referrals. And so I'll talk about this a little bit more, but we were asking questions that we could refer people to those resources for. And so we felt that that was very, very important. We also focused on a very specific geographic area in Travis County where we could solidify those relationships and build a commitment in that particular geography. Next slide, please. And so in regards to the details, we had community health workers with lived-in experience actually be the ones doing the assessments. And this included myself too. I'm a community health worker and a community health worker instructor. And so we were doing these assessments. We provided the survey in English and Spanish. We're actually working right now on translating the survey into other languages because we want to keep doing this. We also did snowball sampling. So after we did one interview and folks really understood what that took and the fact that we were paying $25, we asked, do you know anyone else in your neighborhood or families that might be interested? And so that's really what started the survey going. We also did a lot of testing with the sequences of the questions. And so we found out that some of the questions were better to ask towards the very end. And also when people, after they finished participating with us, that first Christmas, we sent them cards. We actually sent them cards for the past 2 years for Christmas as a way of saying, we are still thinking about you, and we are, you're on our minds, and we just want to wish you happy holidays. A lot of community leaders and stakeholders were also informed throughout the process. So it wasn't just a matter of going to them initially and telling them what we were planning to do, but also reporting back throughout this whole process. And again, we were stressing, and we continue to stress that for us, this is a long-term commitment so that folks are not seeing us just come in, ask questions, and then never see us again. So we really are being intentional about committing to that part of Travis County. And again, I really want to stress this because we were asking questions that we could refer people to, so that if someone told us they had a need, we could hopefully send them to some type of resource in the community to address those needs. And we did a lot of role playing and a lot of practice with the community health worker team to make this more of a conversation and not simply an interrogation. And so if a patient would, if a participant would answer a question that was towards the end, we would kind of be skipping all around to just make it seem very fluid and not have to ask those questions again. And so I would say that when doing these interviews, it's really important to be mindful of that. And you can get some more better answers when people feel comfortable in sharing this as a conversation. Next slide, please, Cheryl. And so we were doing these in folks' homes in 2019, and then 2020 happens and COVID changes the world. And we are no longer going into people's homes, and contract tracing becomes a big emphasis here in Travis County. And so communities are scared. They're calling us, they're texting me, what's going on? What should I do? What do you recommend? And so we really felt that it was very important to be able to add different questions in the context of COVID, and that we needed to have a team that was also looking at resources that were coming online under COVID. We had four full-time staff and 3 interns and 9 volunteers all come together as a team to find out what the resources were in this area to again do this kind of case navigation. And we retweaked the OLA, the household level assessment tool, and we came up with a new survey with about 71 variables. We had skip patterns, we had information referrals, and all that. We had 4 main sections with a total of 43 questions total. The follow-up was optional, so someone participated in the initial assessment. They could opt in to remain in touch and to have other ongoing questions, or they could just simply do one and be done. And we also, because we did not know how many people would participate in that setting, we had a raffle. And we actually did a raffle for $50 for about 100 people, I believe. And so we had money assigned to at least provide some incentives to people that participated. Cheryl, if you could, next slide, please. And so in terms of the summary, we had 2 windows of opening for these surveys. And again, these were done online using our RedCap tool. We worked a lot on streaming that so that it could be really accessible through a mobile device. And we worked a lot on that and having to trim down questions, make it really, really simple, but at the same time concise and easy to do on the phone. And so our first opening was from August to September 21st, again, available in English and in Spanish. We reached about 486 Travis County residents. Out of those, 294 actually requested to remain in touch and to have follow-ups, which was very important for us. You can see the age there was about 47 for the mean. 13% were 65 or older, and we had from 90 to 96 in terms of age. 46% of the folks that participated with this survey were Hispanic or Latin, 42 were white, 13 Black, 3 Asian, 1 African American Indian, 1 Middle Eastern, and 1 classified as other. And so the language preferred at home, 71 was in English, 28% was in Spanish, and top needs that we had for the folks that we were assessing were cash assistance and food and PPE. And so, again, we also had resources at the time that we were referring patients to that were providing some of these cash assistant programs and food pantries and PPE home deliveries. And so, again, we were assessing this, but also referring folks and sending them via text message resources in the community. Jobs also was something that was very important for us to assess. 28% of them had their hours reduced. 17% at that point had lost their job, and almost 6% have been temporarily laid off. And so 8% of them had someone in their household at that time that had tested positive for COVID-19. And obviously, we were also asking about rent and mortgage as something that was of concern. And again, all of this was being done in the context of people's health. And a lot of times we're not thinking about how rent is affecting people's health, but the mental stress and the allostatic load of all these stressors can be huge. And so these were all parts of our definition of community health. Cheryl, next slide, please. And so we had a second window. Thank you. And so we had a second window from October 19th to December 7th. And at that point, it was 767 people that completed that. Again, it was online. It was through their mobile phone. 442 gave us permission to have that follow-up happen. 426 expressed at least one immediate need. We are still doing a lot of data cleaning and analysis on this. We're still refining this survey. We want it to be an ongoing we've labeled it now a community check-in, because we really want this to continue to live and be kind of a way to pulse the community as to what the needs are. And again, we're translating this with multiple languages because we want to reach populations that did not participate in these first rounds. And the other thing that's been very important is that we continue to send resources out. So, for example, folks had said that they had issues with the rent. And so the city of Austin had a rent assistance program. And so we texted everyone that we had in our assessment to have access to that application. And so it's a way to continue feeding resources that we encounter to the folks that need it. And that's another way to be responsive to community needs. Next slide, please, Cheryl. So in terms of lessons, and I'll finish off with this, we had done so much work with our household level assessment, and OLA was ready to go, and then COVID happened. And hearing from folks and saying we have a whole new set of needs made us have to go back to the drawing board, make adaptations, do a lot of this online. It was very telling for us that having a platform like RedCap helped us capture a lot of this. We were really, really happily, we were surprised and we're happy that a lot of folks provided about over 90% of responses to all the questions that were in this survey. So there was a very high engagement. We were also very cognizant, and I think that for everyone here, is that I think it's important that if you ask a question, you should also be able to offer a solution, so that folks can feel that you're not just asking that for research sake, but you're actually investing in the community by referring as much as possible. It's also very important, I think, to build long-term relationships and to have those horizontal power dynamics, so that folks really can feel that they are, like Suzanne said, that we're listening to them and they're listening to us, and it could be a very, very level playing field that way. I think it's really, really important to consider multiple languages and also multiple channels to reach people. One of the things that I did not mention is that folks that did not have access to a mobile app could call us, and we could do a phone interview with them as well. So we provided that additional channel for folks that perhaps did not feel as comfortable or did not have access to the mobile app. Again, compensation, I think, is very important to be considered in research. I think that a lot of times researchers will, consider themselves experts, but we also need to consider community members as experts as well in the communities that they live in. And so I think designing the compensation on the front end is incredibly important. I really think between $20 and $25 an hour should be the minimum. I think if you're asking someone to talk about really deep and perhaps traumatizing or very sensitive information, it should be 50 or more. And so I think that having those standards is really important when designing research and doing that on the front end. And I think that just making sure that we're thinking about research in ways that can end up living and expanding in the communities that we work in. And so a lot of the work that we're doing with our household level assessment is to bring in other community health workers to grow this platform, to have these pulses be a regular way to engage the community. So again, I think it's really important when we're thinking about research projects to find a way to have this stay and live in the community even after funding goes away. And so I think that that's perhaps a new way of thinking about sustainability. But if folks do it on the front end, I think that there's a lot bigger payoff in having these long-term relationships. So I'll leave it at that, but please feel free to continue adding questions, and hopefully we can reach these towards the end. Thank you very much.
Well, good morning or good afternoon to everybody in the room. Thank you for joining our session. My name is Athena Ramos, and I'm an assistant professor in the Department of Health Promotion and the Center for Reducing Health Disparities at the College of Public Health at the University of Nebraska Medical Center. I've also been working for the last 10 years with the Central State Center for Agricultural Safety and Health, which is a NIOSH-funded agricultural safety and health center. So I'd like to jump right in, knowing that we only have about 15 minutes left in our session. And I'd love for everybody to use the chat box for a moment. And if you could, put in the social media platform that you use most frequently with the farm workers and communities that you serve. Thank you. That gives us a great idea. You can keep them coming, but it looks like the vast majority of people are using Facebook and WhatsApp. I haven't seen any others coming across. Those look like the primary two. And if you could now tell us your level of comfort in using social media for reaching farm workers or communities. Would you say that you're very comfortable? You're kind of comfortable, or maybe not so much? So it looks like we've got a lot of people who are pretty comfortable using social media, and some that have a little bit of familiarity and a little bit of comfort. That's great. Cheryl, could you move to the next slide for us, please? So my presentation today is around using social media. And so I want to thank you all for sharing your experiences in using social media to reach farm workers. As we all know, the pandemic has really forced us to think a little bit more creatively about how we were going to reach out to communities and especially to farm workers. And so I wanted to start with this because I feel that social media can be a very effective tool for sharing health and safety information, and it's been used successfully in other industries, like in construction, for example. So social media can be one way that we can diffuse or disseminate information to different audiences. What we learned earlier this week, if you were able to join the session around the National Agricultural Workers Survey, the NAWS, is that most farm workers do have access to digital information. About 95% of the farm workers surveyed through the NAWS had access, and about 92% had access to a cell phone or a smartphone where they could access the internet. And so farm workers have cell phones and they can use these social media platforms. And from what I can tell based on the chat, they are using these social media platforms, and we are using these social media platforms to reach out to them. And so we think that it can be an effective tool, especially in this world of what we'd call research to practice. So this is really an approach to promote the use and the adoption and the adaptation of knowledge and interventions and technologies in the workplace. And this is really an important focus for funders like NIOSH, which is the National Institute for Occupational Safety and Health. It's not just about doing the research, but then being able to turn that into something that's usable, that's practical, and really relevant for the intended audience. And so, as I mentioned, this COVID-19, it really forced all of us across the world to adapt very rapidly. And so our public health strategies also had to adapt. And I'm sure that everybody in this room can attest to that changing dynamic of information. You know, one day you're getting told this, one day it's something else. And so there was just this constant, flux of information. And thinking about farm workers in particular, there was very limited guidance and information that was targeted to farm workers about COVID-19. And in fact, the official CDC and NIOSH guidelines for agricultural employers and for agricultural workers for COVID-19 prevention did not actually get released until June. So if we're thinking about the pandemic starting around February, March timeframe, there was a lapse of about 3 to 4 months in there where there was very, very little information that was going out to farm workers and their families. Cheryl, next slide, please. And so my team and I have been working with farm workers over the last 10 years, but during the last 4 years, we've been working on a project that's targeted to Latino immigrant cattle feed yard workers in Nebraska and Kansas. So for those of you who are unfamiliar with the feed yard, this is a part of the beef production cycle. So if you look at the photo on the slide, this is where cattle are sent to basically put on weight and put on fat until they are to be processed into beef. And cattle feedlots are now employing a large number of immigrant workers, especially Latino immigrant workers. And so being able to provide COVID-19 prevention information to this group of workers was critical for our project and for the group of workers that we've been trying to develop relationships with. And so we developed 2 bilingual infographics that were related to COVID-19. One was focused on preventative strategies that one could use in the workplace, like think, for example, hand washing, wearing a mask, sanitizing common objects, tools, vehicles, those sort of things. And the second was related to mental health promotion strategies. So knowing that the pandemic had caused a lot of anxiety, a lot of stress, trying to give people some information about what are some things that you can do to calm that level of stress and make sure that you're taking care of yourself. So for example, information on healthy eating, making sure you're still engaging in physical activity, watching the type of information sources that you're using so that you're getting reliable and valid health information. So these infographics were created. We posted them on Facebook because based off the research that we had been doing over the past 4 years with our group of farm workers, we had talked to them about where they would like to access health and safety information and what type of health and safety information they were interested in. And we learned that online and videos and in-person trainings at the workplace were some of the highest rated mediums for communicating health and safety information. They were also very interested in general health and safety information, respiratory health and safety information, and of course, how to prevent injuries and illnesses on the job. So making sure we're providing COVID information aligned very nicely with the types of information that they said that they were interested in. So we ran our infographics as boosted ads on Facebook. And they ran between April and May. We ran them 2 times in that like month and a half time frame. We invested $454, and you can see the results of that boosted post. You can see here the workplace preventive strategies had a really strong reach of over 41,000, almost 42,000 people saw that. And the mental health promotion strategies had 23,000 people who were reached. So in all, we reached almost 65,000 people and had almost 6,000 engagements with the infographics. So you can see this was an incredible reach for a very short amount of time. Now, some of the things that we did is not only post them on Facebook and think about where we wanted the audience, where was our audience. So we looked at geographically targeting these ads to places where we knew that there were cattle feedlots, so we knew there were workers. And then we also made sure that we used some of that demographic targeting available in Facebook to look for, Spanish dominant, to look for people who had specific interests in cattle, because we know from our workers that they're very proud of working cattle, and that's much more than a job. It's a lifestyle, and it's really part of their identity is to be a cowboy or to work with these animals. And so we use that as well in our targeting. And then finally, we connected with influencers like extension agents and people who we knew had strong connections with our workers. And so we asked them to like and share the post. And you can see that the post really did a lot of, it went viral, and it was a very small financial investment in our end for a very big return in terms of the reach of people for those. So what are some of the lessons learned from this? One is that social media works for reaching Latino farm workers, especially Facebook and WhatsApp. And I think you all know that as well. We found that this was a very cost-effective method for reaching farm workers as well. And this is a way for us, it was a little bit of a wake-up call for our Agricultural Health and Safety Center that we should post more Spanish language content on our social media platforms and really build up that follower base to make sure that we're reaching farm workers not just when we want them, but continuously, with lots of different health and safety information that our center is producing. And so we feel that virtual outreach is a way that we can not only change things in a pandemic, but it's a way to extend and supplement our traditional outreach strategies. So with that, I know we have only about 5 minutes, so I'm going to turn it back over to Cheryl. Thank you.
Great. Thank you so much. And I'm going to do just a couple quick things. We want to have some time for discussion. I want to move to the last two slides briefly just to show that there's some additional resources that we invite you to check out. Also, our contact information is here on the last slide. I think we're all happy to have additional communication. And I believe I wanted to mention that whoever posted the thing about the cursor, thank you. I wasn't aware of that. And that's why I kind of stopped checking in on the chat, so that wouldn't be distracting. We will take a look at all these and try to follow up. And Lisa, I think you might need to step in and say something about the evaluation. So I'm going to pause here for that.
Yes, thank you so much. I just wanted to take a moment to draw everyone's attention to the chat box where I posted the evaluation survey for this session. Please take a minute to complete the evaluation. We really appreciate your feedback. Thank you.
So I'm going to try to catch up on the chats. And let's see, and Athena and Ricardo, if there are any that you saw that you want to mention or respond to, I'm going to pause here while I try to catch up on some of these as well.
I think there was a question in terms of the NAWS, the National Agricultural Workers Survey. It currently does not include H-2A workers, and it only refers to crop workers. So those who are working in livestock are not included in that survey.
And I think there was a question, I don't know if it was for Suzanne's and my part. I'm trying to find it here, but I think it had something to do with kind of when we were connecting with people and where. And so I'll just mention that we tried to have our Farmworker group help us know when to go out. So we were generally going in the evenings and times where the individuals would be off of work and be at a location they normally would be at, or alternately going to the labor camp or, you know, the location where they were at. So that's kind of, yeah, clinic parking lot. Yeah. And then I noted that I think all three of our presentations were only in English and Spanish. However, that being said, yes, working with Indigenous languages is really, really important. And it's an area where and with any of them, I think that it's important to have the translation be done and the interpretation be done in high quality, so that it's.
Yeah, we've had some experience with Indigenous languages, and in my area here in Nebraska, it's mainly Mayan people from Guatemala that we're running into, and the primary languages are Kanghoal and Mam. I know a lot of people ask about Quiche, and Quiche is not so much here. There are some Quiche speakers, but primarily it's Kanghoal and Mam. And one of the things that we did learn with Indigenous languages is that oftentimes you don't need to put it into any written format. It's more important to have it in audio or video formats. So like, for example, we did some COVID information for meatpacking plant workers, a lot of which are coming from all over the world. But one of the languages that we did make materials for was Kanghoal. And the community group who did this, they translated everything orally. And so they interpreted our written materials into an oral format, and they put it with some background music with the marimba, so that it was a little bit more culturally engaging. And it seemed to work for that community.
I believe we're right at 11 o'clock. We want to be respectful that there may be another session that's going to be starting. I'm not totally sure of the schedule. So if any of you need to, drop off to go to that, we just want to extend a heartfelt thank you for joining today, for participating through the chat. Hopefully next year we'll be in person for this conference and can get to meet and see each other. So any final closing things, either Lisa from kind of the event perspective or from any of the speakers?
No, and just wanted a big thank you to our presenters today for this valuable information. All the feedback in the chat is very positive. So thank you so much. And thank you to our participants for joining us today. And again, please be sure to complete your evaluation so that our presenters get that positive feedback there as well. Thank you so much.
Thanks to all. And again, you've got our email addresses. So we hope you have a great rest of your day and conference. Thank you all.